KOOL97.
Cool listeners, welcome to Ask the Oncologist, where we focus on colon cancer awareness. With us this week is Dr. Toni Barnes. She's a Haematologist and Medical Oncologist at the Hope Institute. Welcome to KOOL97FM, Dr. Barnes. How are you?
Thank you very much. I'm fine. How are you?
Oh, we're well, thanks. Okay, so we've been doing this little feature as we look at colon cancer, and it's colorectal cancer pretty much that we've been covering. Now, he was told that he has polyps in that area and wants to know if that means that this will eventually become colorectal cancer.
So, polyps are really non-cancerous growths that are on the lining, the inside lining of the large intestine. So, the colon, over time in people, especially as you get older, once you reach the age of 40, 45, these growths start to come up. And over time, they say 5 to 10 years, these growths can develop into cancer. So a polyp doesn't necessarily mean you have cancer now, but the polyps need to be removed for testing. And once the polyps are removed, it dramatically decreases your risk of developing colon cancer in the future.
Is a colonoscopy my only option for screening, or are there other ways to screen for colon cancer?
We have multiple screening methods available for colon cancer. The best one is still a colonoscopy. Why? Because when you do a colonoscopy, in addition to identifying the polyp that is there, you can remove the polyp at the same time. And if the polyp was dangerous, if the polyp was one of the ones that are at higher risk of developing into cancer, removing the polyp at the time of colonoscopy removes your risk. So that polyp wouldn't then go on to develop a cancer, and you wouldn't have to worry about it for another 10 years. When you use another method, so there are tests like a virtual colonoscopy, which is instead of the probe going into the back passage to look at the colon and see the polyps, they can do a CT scan where you just lie down on a table and they're able to look at the colon with images like an X-ray. So you wouldn't necessarily have to go through a probe going into your behind, but you would still have to go through the process of doing the washout to get out all of the stool. The disadvantage is when you do a CT scan, if we see something, there's nothing we can do. We still have to go on and do a colonoscopy so we can get access to and remove the polyp. You can also do stool tests. So there are various stool tests now where they take a sample of your stool and are able to test it for blood or test it for DNA to see if there are any cancer cells in it. Those tests are not as sensitive, meaning that sometimes you can have a negative result even if you have a polyp. And unfortunately, if you have a positive result, you would then have to get a colonoscopy. So although you don't have to do a colonoscopy, it is generally the best way to screen because you can also do an action. You can remove the polyp once the screening has been done and you find something wrong.
How often should someone get screened if they have a family history of colon cancer? And again, I underscore it's colorectal cancer.
The screening time depends on your risk. So I just want to say first, for somebody who does not have a family history, you should be doing your colonoscopy screening starting at the age of 45. If you have a family history, especially if that is a first-degree relative, you should start your screening at age 40 or 10 years before that person was diagnosed with colon cancer. So if they were diagnosed at the age of 48, you should start at 38. Now, how often you do screening is not really dependent on the family history. It's more dependent on the type of screening test that you do. So for colonoscopy, whether you have a family history or not, you should get a colonoscopy every 10 years. If at the time that the colonoscopy was done, they find a lot of polyps or they find really large polyps, you probably will have to repeat your colonoscopy in 1 to 3 years. If you do a stool test, the stool tests require you to get screening more frequently. So that's every 1 to 2 years. And if you get the CT scan colonoscopy, then you're going to have to get it done every 5 years.
What advice would you give to someone who was just diagnosed with colon cancer?
The first thing that you need to do is build a care team. So your doctor would then refer you to a surgeon who's going to evaluate whether the colon cancer can be removed surgically. And you'll also need to have an oncologist as a part of your team in case you need to get something like chemotherapy or immunotherapy. And then other members of the team like nutritionists to help you to change your diet to get through the treatment process. So all of those team members are very important. Staging is how we determine how we're going to treat the colon cancer, whether surgery alone is appropriate or if you need additional treatment like chemotherapy. So that is usually done with a CT scan, and your doctor will send you for the CT scan in order to determine the stage. And the final thing is that you need to build around yourself a support system, whether that's friends, whether that's family, whether that's people from work, from church, people in your neighborhood. You need people who are going to offer you emotional support in addition to the support that you're going to get from your doctors, in addition to the information that they're going to give you. You need people who are going to be there when it's difficult, when you're not sure if you can carry on, people that can help to keep your spirits up. So all of those things, in addition to the medical management, are really important.
Thank you, Doc. So many thanks to the Jamaica Cancer Society for partnering with us on this program. So all the very best to you, Doc. Take care.
Thank you.
You're welcome.
KOOL97 Radio.